Welcome, everybody, to the Get Healthy Brand webinar, and we are in for a special treat tonight with our topic and our special guest, Dr. Cheryl Burdette, who is here from XYMOGEN. My name is Dr. Tracy Stroup. I am the Chief Health and Growth Officer right here at Get Healthy Store. Before we get started tonight, and what we will be talking about this evening will be MCAS, mast cell activation syndrome, and histamine receptor management in clinical practice. So this is going to be absolutely amazing. I'm actually super excited for this topic. I've been waiting all week. So I just have a few announcements to get through before I turn this over to Dr. Burdette. Obviously, we'd love for you to join us at any of our events here. Mindshare Leadership Summit in Scottsdale, Arizona is popping up quickly. That is September 26th through the 28th. So if you're in that area or you're familiar with Mindshare, go check it out, sign up, and come see us at our booth. We're also at Zenergy October 3rd through 5th, and that's going to be an amazing energy event. So if you love frequency medicine, you love energy medicine, that is definitely a place that you want to come. Go check out Zenergy and sign up for that. And then we are at the Nutritional Frontiers Professional Training Event, October 18th through the 20th. That's going to be in Pittsburgh, Pennsylvania. So great brand, one of the top sellers on our technology. And so we will be there educating and representing the Get Healthy platform. Also, our latest is our new blog that we just released. So great job to our marketing team, Kat Dara, who is our Vice President of Marketing, and Courtney Bell, who is our Director of Marketing, have worked long and hard here. So I'm super excited to introduce this to you tonight. But without further ado, let's get into our topic and our very special guest, Dr. Cheryl Burdette. She is the Director of Education at XYMOGEN, another top seller, another top brand on our technology. She also has an extensive background in the functional medicine institute here. Precision Point Diagnostics, Theradura. Dr. Burnett was involved in the study and design of translational research and has lectured extensively internationally. I've seen her come across my Facebook feed so many times. So I'm super excited you're here, Dr. Burdette. I'm going to let you kind of take over, start on this topic, which is, I feel, really hot and heavy in the industry and much needed education. So thank you for being here.
Yeah, my pleasure. And I think you're right that we see more and more of this as an issue. And what I mean by that is we're probably all familiar with histamine intolerance, even mast cell activation syndrome, but we see more and more assault to the immune system causing histamine to continue to be upregulated. So some examples of that, of course, ongoing infections like Lyme and mold can make us more susceptible, and we'll look at some of those mechanisms. But COVID is another one. So what we are commonly seeing is that when our patients have another bout of COVID, it will kick off a lot of those mast cell issues or histamine issues that they might have had under control in the past. So yes, an assault from every direction in terms of what we're faced with from infectious disease, environmental onslaught of toxins, and just general shifts in immunity that make it harder and harder to deal with more and more load of histamine. So these are my disclosures. I'm the educational director for WholeScripts, also for Precision Point Diagnostics, a laboratory, and for Origins Incubator, a practice management solution, stockholder in XYMOGEN. So I want to talk about this. So when we get into the conversation with our patients about or when we get into a conversation in terms of thinking about where histamine is coming from, we think about, of course, that idea of leaky gut. And in terms of leaky gut, we're familiar with discussing with our patients or explaining, okay, the gut is a barrier between foods we eat or bugs and the immune system reacting to it. So if the gut becomes leaky or more permeable, things leak through intact, they ignite the immune system, that creates more histamine. And that is absolutely true. And that is absolutely more and more supported in the research. And it explains part of the connection between what happens in the gut and the systemic inflammation that's a result of that. However, it's not the only thing that happens in terms of how the gut either is involved in more creation of histamine, but can also be involved in more degradation of histamine as well. So as we build up that gut lining, as we put that barrier back in place, as we keep the fort wall intact so that foods are not leaking in, so bits of bugs are not leaking in and igniting the immune system, as we do that, we build up the gut lining. And a consequence of that is increasing the thickness and the robustness and the activity of things like the microvilli that are in the small intestine. And so not only are those involved in absorption, so that function improves, but they also make brush border enzymes, including an enzyme called diamine oxidase. And diamine oxidase is an enzyme that degrades histamine, and in fact is the primary way our body gets rid of it. And not just in the gut, it turns out diamine oxidase that we produce in the gut, we absorb through lymphatic channels, moving it through circulation so it can deal with histamine systemically. So when we talk about the root of inflammation being in the gut, we are more and more right. It turns out there are more and more mechanisms that validate that predisposition or that hypothesis. And so as we work on our gut building, we plump up the microvilli, they create more diamine oxidase, and it's a major way that we control histamine. And so histamine was first discovered back in 1910 by Dale and Laidlaw, the pioneering researchers who discovered its function. And they found out it could be secreted in these granules from basophils and mast cells, from immune cells in the gut lining. And from there, when we think about strategies to control histamine, we think about characteristics of those cells, particularly mast cells. And so it invokes our use of omega-3 fatty acids, which build the membrane of a mast cell so it's less likely to degranulate and release that histamine. It causes us to think about things like quercetin, which also build the mast cell. But interestingly, more and more research, but no surprise to those who are here, the better our microbiome, and so even use of probiotics contribute to this, it will regulate genes that produce more mast cells. So again, back to those gut-based connections, as we work on what's happening in the gut, as we improve the microbiome, we upregulate genes that cause us to produce less basophils, less mast cells, and it's again one more way we're controlling systemic inflammation through our strategies in the gut. So the gut contributes, of course, to histamine intolerance, and so what happens in the gut is one of the primary ways we become more histaminergic. And this is why we express this diamine oxidase, this enzyme in the gut lining. And in fact, what we know is that we'll have more activity initially when we're under assault. It's there to protect us. But over time, for example, when you biopsy the gut of a Crohn's patient, somebody with irritable bowel disease, you see lower levels of diamine oxidase. So it's there to protect us, but after constant assault, continuously eating foods we're sensitive to, maybe having dysbiotic bacteria that are producing histamine, the function wears out and we're left with more inflammation, conditions like Crohn's disease, also colic in newborn babies. When they look at the guts of newborns, those that have colic produce less diamine oxidase than control. So from the beginning, when we get here in terms of controlling gut-based inflammation, diamine oxidase is really an important part of that. So that's one big way. The gut, of course, is one of the ways that we control histamine. So we want, and then in addition to that, we want to figure out what is the trigger. So to identify an upregulated mast cell is very helpful in patient care, but always asking, why is it it that way. That may be gut-based inflammation. That might be a subset of that, more specifically lipopolysaccharides. They're really good at causing a mast cell to be ignited. That might be mold or Lyme. That might be genetic predisposition. And so examining where this is coming from, putting the barrier in place becomes critical, not just from keeping those naive T cells from being activated, but also by producing more enzymes that degrade histamine, desensitize and retrain the immune system. And that's back to, for example, the microbiome. And also back to other strategies like omega-3 fatty acids that increase interleukin 10. IL-10, when IL-10 goes up, it improves function of something called Treg cells, and that keeps us from overproducing cells that produce histamine. We can decrease mast cell activation. We'll talk about that, quercetin and omega-3 fatty acids, and ultimately we can degrade that histamine. That might be diamine oxidase. Methylation is involved. We'll look at that, as is even acetylation. And of course, we never want to forget that we're practicing in a functional medicine paradigm, which means there's a whole person. We want to maximize what the adrenals are doing because they produce cortisol that will help to decrease the impact of histamine. We need to talk about lifestyle interventions, stress management, vagal nerve activities, meditation, sleep. Why? Because stress directly triggers degranulation of a mast cell. When there are cortisol receptors, also receptors for epinephrine and norepinephrine on a mast cell that cause it to degranulate. And we see this all the time. Rashes that get worse under stress, psoriasis that breaks out more under stress, or inflammatory conditions that become worse when there is an increase in stress. Thinking about what we're eating, embracing more of an anti-inflammatory diet, high in omega-3s, all of these things become important. So when we're thinking about things that happen in the gut, where we are always continuing to connect that to what's happening in the rest of the body. So I found this to be a fascinating piece of research because what it says is that even something like attention deficit disorder is linked to production of diamine oxidase. And so they looked at kiddos who were struggling with focus and having neurodevelopmental issues. And what they found was they had a variant in terms of their ability to produce this enzyme that degrades histamine. And then from there, what they found was that there was an association between DAO and what was going on in terms of IQ and working memory. And so what the kiddos that had less diamine oxidase had more trouble in terms of cognitive function. And so leads us down this path of controlling gut-based inflammation as a tool for helping the brain to be less inflamed as well. And so then what we see is that here, it's always nice to identify a problem, like physiologically speaking, kiddos with attention deficit had less diamine oxidase than those who didn't, but can you reverse it? Does treating change that? So here we see that's the case when you give the enzyme diamine oxidase, and they did that for 4 weeks. What they found was that it improved all the symptoms they were looking at, 22 symptoms, including GI symptoms, but cardiovascular symptoms, respiratory symptoms, skin conditions, all from 4 weeks of taking oral diamine oxidase substances. So what we know is there's a balance, and this we're very good at this concept from functional medicine. So in our functional medicine paradigm, we've recognized for years, for example, it's not just the toxin that you're exposed to, but your ability to degrade it. A kiddo with autism could do much worse with mercury than somebody that doesn't have autism, and we recognize that that inability to detox is part of the individuality. The same is true of histamine. It's not just the amount that you're eating or producing, but your ability to degrade it that plays a role in terms of symptomology. So when we are more intolerant to histamine, when we can't degrade histamine as well, we can expect these symptoms. And it's appropriate, actually, that headache is first on this list. And and the GI stuff comes next. File that away. When you have a patient suffering from headaches or migraines, 80% of migraine sufferers have a decreased production of diamine oxidase. And again, trials where they give diamine oxidase, as many as 90% of that population, and we'll look at this study, had improvement in migraine symptoms. So we know histamine is intimately connected to things like headaches and migraines, and being able to utilize more diamine oxidase, for example, as a supplement, can help to break the cycle of pain, calm things down. And then also it can be used as part of our leaky gut treatments, because when we take it with a meal, we degrade the histamine that's there, and that keeps the gut lining from being degraded. And a consequence of that is you plump up your own microvilli and begin to make more of your own endogenous supply. So this is what we really want to see. This is one of those things that we love about nutritional interventions. It's for many of them, it's not something that you necessarily have to be on for the rest of your life. It's not often like certain medications where you start off with a smaller amount and then you need more and more and more. In fact, it's quite the opposite, because as we take diamine oxidase exogenously, we degrade histamine, our microvilli recover, we make more of our own. And so it's something that many people need less and less of over time, really facilitating that vis medicatrix natura, that ability for the body to heal itself. So when do we see low diamine oxidase? We see it in inflammatory conditions, headaches, GI issues, Crohn's disease. File this one away as well. Eczema is one where diamine oxidase works quite well, not only degrading the histamine, but keeping inflammatory cells from migrating into the tissue space. So really a big deal there. Now, I love this graph because I think it really illustrates how impactful histamine is. Our patients think about, in terms of histamine, everyone's familiar with it. Here's our histamine. And of course, we think about, rashes or being more congested, shortness of breath. But it's fascinating to think about that histamine plays a role, for example, in terms of driving more estrogen and dysmenorrhea, so estrogen dominance. And so when we are about to cycle, for example, of course, progesterone drops off. That's what causes the lining to shed. If progesterone drops too much, this is responsible for PMS symptoms, again, headaches, cramping, heavy periods, and then so we'll often jump in with our progesteronic therapies, whether or not it's progesterone or phytoprogestins from botanicals, and they work most of the time. But as patient care would have it, nothing works always. So another thing that drops off the week before your period is diamine oxidase, the enzyme that degrades histamine. So as it drops, you'll feel histamine more. So as I started to learn about this, I would ask women, do you get itchier the week before your period? And if they're like, oh yeah, I do notice that, I would start thinking about this DAO connection. Or more importantly, if they had things like headaches or PMS and we worked on progesterone and they didn't see improvement, I go, probably a DAO issue. And as we work there, we'll see better outcomes. So here we are, in the also the central nervous system, so that big role in terms of headaches, even nausea and vomiting. And over here to the right was more cardiovascular disease. And so in terms of oh, nope, it's to the left. Here it is. Cardiovascular disease. And I want to point this out because even things like arrhythmias respond amazingly well to diamine oxidase treatments when that's the issue, when there's too much histamine. So I'll never forget this functional medicine provider who I was working with, and she was saying, I just can't keep my heart in rhythm. The arrhythmias are really bad for me. And she had done fish oils of magnesium and copper and hormone balancing and eating well and had done all the things. So she thought, you know what, let me look at my diamine oxidase. And so measured levels and then saw it was low and began taking diamine oxidase. And as she took that, what she's noted was that her arrhythmia was much improved. She was staying in rhythm way better than she was previously. So it was an eye opener to me to just see just how far reaching histamine can be, and how having new ways of treating it really gives us another tool in our arsenal, especially for some of those non-responders. So here was that piece I was mentioning, that DAO varies with menstrual cycle. And what we also know is that DAO can be a marker of mucosal damage. So like mentioned, I have a laboratory precision point and we measure DAO, and it's just fascinating to see because you'll see people, for example, rheumatoid arthritis, no range of motion. And again, they've tried standard changing the diet, fish oils, curcuminoids, and that DAO comes back low. And as it's treated, seeing things like range of motion improve, the arrhythmia that I mentioned. So DAO is a therapy, but you can also measure it. And what it tells us is about the mucosal lining. So it can be used as a marker for mucosal maturation. As the gut lining atrophies, we produce less diamine oxidase. So we're all pretty familiar with, for example, zonulin-mediated leaky gut. That's where zonulin tells tight junctions to open and things flood through. But it turns out that's not the only way we get leaky. For example, lipopolysaccharides damage tight junctions, also damage occludins, zonulin occludins and claudin that tell tight junctions to close again. And then finally, you can just have atrophy of the gut lining. You can atrophy so much you ulcerate. That's a leaky gut lining. It's just not necessarily zonulin mediated, like NSAIDs. Abusive NSAIDs would cause ulceration. Ultimately, diamine oxidase goes down, and now you're left with a gut that's not only atrophied, but can't degrade histamine. Here's a better example of that. A common drug that is used to help the gut feel better actually atrophies the lining, and that is PPIs, those proton pump inhibitors. So fascinating, there they are. People are taking them for reflux because they hurt, they burn when they eat. You take a PPI, it suppresses hydrochloric acid, but it also produces more asymmetric dimethylarginine. That's not important, but but what's important about it is that inhibits blood flow to the gut. It creates an atrophy of the gut lining. So there you are, you're on a PPI to feel better. It atrophies the lining. It also inhibits diamine oxidase, it turns out. And so now you feel histamine much more acutely because your lining is thinner and you're not breaking it down as much as you were. So you see why people get stuck in place with some of those things. So why do we have histamine excess? I mean, it could be allergies, it could be upregulation of mast cells. There are bacteria that do that. We could be eating more histamine foods or things that we're sensitive to, or alcohol that's full of histamine, or you could be deficient in diamine oxidase. So we predominantly produce diamine oxidase in the small intestine, and that makes sense. We want to deal with histamine produced from bacteria. We want to deal with histamine that's a result of fighting infection in the gut and even from foods. However, if you happen to be pregnant, then your placenta makes a huge level of diamine oxidase. And the reason for that is we even have to push back at inflammation to make it onto planet Earth. So the placenta making that histamine decreases risk of miscarriage. And in fact, if you look at placentas who have low levels of diamine oxidase, that's a risk factor for miscarriage. So there it is, protecting baby from inflammation, from histamine. We birth baby, we birth placenta. And then the next step of that is that diamine oxidase remains high in mom's body for the next 2 to 4 weeks. that actually gets passed in the breast milk and is one of the things that's responsible for setting up a healthy microbiome. So this connection of diamine oxidase and gut-based health goes right back to the beginning. As we're born with a leaky gut, one of the things that gets delivered through mom's breast milk is diamine oxidase. And so we can draw from that. It's one of the tools that helps a leaky gut to heal. So generally we make it in the small intestine and a little in the colon, a teensy bit in the kidney, a bunch in the placenta if you happen to be pregnant, and very fascinating as it works from there. So when we do have higher levels of histamine, of course, rashes and more itching, but even more vasodilation. And another way of saying that is unregulated dilation. So posterior orthostatic tremor syndrome, or POTS, that we are seeing a lot of as sequelae from even COVID. So post-COVID cytokine storm that can damage the inside of the vessel. When the vessel gets damaged, we don't get a good signal when we go from sitting to standing. So the adrenals pump out epinephrine, norepinephrine when you go from sitting to standing, to cause vessels to vasoconstrict, to shunt blood to our head so we don't get dizzy, to regulate blood pressure when we change positions. So in a damaged vessel, we don't do that nearly as well. So histamine is one of the things that damages the inside of the vessel. It gets upregulated with COVID. And so this can be part of the reason we see more POTS after that. So histamine controlling strategies are often something we're reaching for as part of controlling secondary symptoms post-infection. But that's certainly not the only place that we think of it. This is a world that is perfect for upregulating mast cells, from leaky gut, activating naive T cells, signaling an increased production of mast cells, to huge amounts of environmental toxicity. Those two stimulate immune cells, T cells, and then genes for production of mast cells. Like I mentioned, stress does this as well. So we've got a lot of choices for why there's more production of histamine. And here are some of the consequences. We don't heal as well. It messes up circadian rhythm. It can cause more arrhythmias, et cetera, et cetera. So I think this is always an important one to think about when there's an increased production of histamine. Again, not just headaches in the brain, but causing more aggression and irritation and disrupting our sleep-wake cycle. So of course, when people don't sleep at night, we're thinking about, strategies like melatonin and magnesium and GABA. All of those are worthwhile strategies, but it is inflammation that will interrupt some of our signaling of melatonin, things like IL-6 and histamine. So sometimes you're going to find yourself in the more inflamed patient dosing things like a diamine oxidase before bed, dosing things like curcuminoids from turmeric before bed. And because as we lower inflammation, that helps us to produce more melatonin. As we lower inflammation, it helps directly with our sleep-wake cycle. Our patients understand this well. They know when I take Benadryl, I get sleepy. And so that same idea of as histamine goes down, we're better able to sleep. There are just other ways of doing it. Okay, so if we have somebody who's overproducing histamine, we do want to figure out the cause of that. We also want to degrade it. And so the primary way after we make histamine from histidine, that's step one, then you want to break it down. Step two is diamine oxidase. And next, you'll also see that you have to clear aldehydes. So B vitamins can help with that. B6 increases activity of aldehyde dehydrogenase. Interesting, B6 is also a cofactor for DAO. I mentioned migraine sufferers really struggle with histamine. And so if I asked you a botanical for migraine, you might say, oh yeah, feverfew shows up in the research. One of the things it does is it increases activity of aldehyde dehydrogenase. So it's step two in terms of removing the histamine. Feverfew also shows up in hangover remedies because the same aldehyde dehydrogenase. And let's say it another way, when you drink, the alcohol produces all this histamine and is using all that aldehyde dehydrogenase activity. And so it makes things much more histaminergic. from there, in addition to that, the next way that we would remove histamine from the body is methylation in histamine in methyltransferase, which is driven by S-adenylmethionine. And so, and this happens, this was one of the primary ways to remove it from the tissue space. So think about your SAMe and then all your ways of recycling methylators. We're back to some B6 again as a methylator, 5-methyl tetrahydrofolate, and methylcobalamin, which I'll just say B12 right now because it's shorter to write. But yeah, that's the secondary way we remove histamine. In fairness, we also acetylate histamine. That wasn't included here, so I added it on. And B5 is what acetylates histamine. And if we look at eclectic remedies for allergies, you see things like high-dose B5, even using as much as 500 milligrams twice a day. And of course, these nutrients, so epigenetic, also helping our adrenal function, and adrenals making more cortisol to help with this picture as well. So we've got a lot of ways to get histamine out of the body. Now, eliminating histaminergic foods is one way to do that. Now, when you look at this page, you're like, wait a minute, fish, omega-3 fatty acids, those stabilize the membrane of the mast cell. What do you mean by this? Well, some of these fish actually have high histamine. So if you have a paradoxical presentation in your history, they get itchy after fish, and you're thinking omega-3 should be useful. Think about, they may have a lower supply of diamine oxidase because the higher amounts of histamine in some of these fish. Now, other things are more logical that we would think of: the aged foods, the aged cheese, the aged meat, the older red wine, all of those high histamine foods. And so you go out for that nice meal, it's a histaminergic mess. So not eating those foods, or if occasionally indulging on those foods, even taking some DAO, some DAO before you do that, makes good sense. Now, okay, we're back to that gut-based patient, and you're thinking, I want them dietarily to improve their microbiome. So you say, I want you to do more kombucha for the flora. I want sauerkraut in there. And they come back and they say, oh my gosh, that really made me hurt. Okay, and you're like, well, why? It has good, healthy flora. Well, the other thing there is high amounts of histamines. Anything that ferments, anything that ages, even if we call it ripening, as it ages, it degrades and forms more histamine. So that patient who calls you and says, I'm having a horrible headache, and you say, what did you eat today? And they say, it can't be today. It was just cantaloupe. I've been having the same cantaloupe for the past 3 days in a row. It could be the cantaloupe that day. And the reason, because as it ripens, as it degrades, it forms more histamine. That's why the advice we give people on a low histamine diet is make sure you freeze your leftovers quickly, that kind of thing, because we don't want it to degrade and produce more histamine. Like I mentioned, red wine produces more histamine than white wine. So when people say I can tolerate white wine, but not red, that's a clue that maybe their DAO is lower. And even look at champagne, huge amounts of histamine. So this explains all the headaches after New Year's. So here's a piece where they look at diamine oxidase activity in patients with Crohn's disease. And as I mentioned, when you biopsy their gut, you see lower production of DAO. And here are some medications that inhibit diamine oxidase or otherwise interfere with histamine metabolism. So the irony, right? Because here we are, our H2 receptor agonists, but also decreasing activity of DAO. And so now it becomes more difficult when you're trying to get off of these things. Or how about an antidepressant, decreasing our activity of DAO? So now more histamine, more inflammation. We recall that tryptophan converts to serotonin in a low inflammatory environment. As inflammation goes up, tryptophan now gets converted to kynuric acid, quinolinic acid, things that make us ache instead of feeling good. And so now here you are on this antidepressant, but it's inhibiting DAO, so it's still creating more inflammation. You see how people get stuck in place, but more optimistically, more glass full. You see how when we put a functional medicine paradigm in place to repair the gut to handle histamine, it creates opportunity where it's much easier for people to be able to back down certain medications and even potentially eliminating them as they move forward. Okay, 5 file this one away for that next kiddo who's just really suffering with eczema. Of course, you're going to get them off the foods they're sensitive to and work on what you see in the gut. But in addition to, and you're going to use your fish oils and your probiotics. But in addition to that, a subgroup of patients with atopic eczema have low diamine oxidase, and this just can be really helpful as a breakthrough to get that to calm down. I'll also give a shout out for Diosmin. It's a bitter orange flavonoid. I've had it work fabulously well with eczema in little kiddos and adults, and that's another one that inhibits migration of white blood cells to the tissue space. So like I mentioned, when we have low DAO productivity by the placenta, that's risky for baby, and that's risky for pregnancy in general. Also, there'll be less DAO to pass on in the breast milk. So a hindrance in terms of setting up a normal microbiome. Now, I did mention that taking it supplementally allows the microvilli to plump back up and to make more of it on our own. And usually this will happen in most people. However, there are some subsets of the population that have polymorphisms or SNPs in terms of their ability to make diamine oxidase. Autistic kiddos can be a part of that group. And then on the spectrum, and we even saw attention deficit disorder can be an issue as well. So we're familiar with this idea. We have food allergies. They begin to degrade the gut lining. They make IgG antibodies. IgG antibodies are implicated in further creating more permeability, causes a mast cell to be degranulated. But the more we work on that gut lining, not only putting that barrier in place, but also plumping up the microvilli to produce more DAO to neutralize histamine before it even becomes a problem. And so some people get the perception that DAO only works in the gut, but that's not accurate. Here in American Journal of Physiology, they talk about how that diamine oxidase that either we make orally or take orally is taken up by the mucosa and carried into circulation by lymphatics and delivered into circulation. So yes, we can use it as part of our leaky gut strategies. Yes, we can use it to calm down gut-based inflammation, but you can even use it acutely. I find for HisDAO work like a Benadryl without making somebody tired, or acutely if someone starts to have a first sign of a migraine, take 4, or even things like spider bites I've seen it be effective for. Lip swelling secondary to food that was eaten. So we can use it both chronically and acutely. So again, like I mentioned, we can take DAO, but there are other things that we can do to increase production of DAO. So fish oil that we're taking not only stabilizes a mast cell, but also plumps up the microvilli to make more DAO. I mentioned B6 is a cofactor. Copper is a cofactor for making more DAO. Saccharomyces is a probiotic that has been implicated in helping us produce more DAO. But in general, anything you do to plump up the gut lining, to plump up the microvilli, will result in better, stronger production of diamine oxidase. So this is fascinating too. So people that had low DAO when they took oral chemotherapeutics were more likely to have nausea from that. I've used it with IV chemotherapies as well when people are suffering from nausea, with some efficacy there too. And this is one piece of research. There are many pieces that talk about low DAO with headaches. It's a real go-to for this. I found this piece of research a little bit funny because they're like, and all we can do is a low histamine diet. And I thought, well, yeah, that's one thing and it's helpful, but we have all these tools in our arsenal. We can give DAO, we can plump up the gut lining, we can use fish oils, we can use cofactors. And so if you're in a standard of care paradigm, your tools are much more limited, but that good functional medicine allows us, when we heal the body, to really do this quite well. So I wanted to just again stress, not only is DAO low at people that have migraines, when you give it, there's positive outcomes. So here they did a study in Spain. They gave DAO to migraine sufferers, and they showed that 90% of migraines could be treated or even prevented through administration of the enzyme called DAO. And so they selected people that had prevalent migraines, a high incidence, and a high incidence of those had deficiency, 87%. 40%. And, but still 44% of people without migraines had deficiency. And when they gave DAO, they saw a decrease in symptoms of DAO as much as 90% of it. So that is just really mind-blowing. Here is one of my own patients. And so she presented with chronic hives and gut issues, and she was only maintained on prednisone. And so she'd never had these issues before. She's like, what is different? And so started going through her history, and she'd recently had a baby. Okay, so you had a placenta as well. You are producing all this DAO, and then it drops off. Okay. And then what else? Postpartum depression. She got put on an SSRI, which we saw inhibits DAO. Also, she was experiencing some lower thyroid as part of her postpartum depression picture. Well, thyroid hormone actually metabolizes DAO. I'm sorry, no. Thyroid hormone metabolizes histamine. So it helps to clear it. So it's this perfect storm. Her body got used to having more diamine oxidase, birth baby, that's gone, get on a medication that inhibits her own DAO. Also, thyroid goes down, which previously was helping her to clear more histamine. So this perfect storm where these hives occur, this is what her level of diamine oxidase looked like. So quite low. And then after only 2 weeks, shoots up really nicely. And so what happens is she's able to back down the prednisone, get off the prednisone. Her gut feels better. Her energy is better. And she says, this is the first time I feel better, not worse. I have hope. And so this was just somebody suffering from hives. She wasn't that interested in integrative medicine or what she was eating or what she was doing. But when she got introduced to these concepts and seeing how you change what you eat, that change what's going on in your body, and how a supplement could be so powerful, it really piqued her interest. And so she's like, now what can I do next? So it leads us to the diet and lifestyle piece. And I say, if you really want to maintain, you got to continue to take care of your gut. You got to continue to manage stress. You want to know one of the best ways to damage your gut? Do not manage stress, because stress puts us in fight or flight, not in rest and digest. It creates an ischemic event to the gut, decreased blood flow to the gut. The next part, more permeability, more atrophy, less brush border enzymes, less diamine oxidase. It's a feed forward. So it's an easy world to end up with a leaky gut that determines so much of what's going on. Now, I want to say a little bit about from a different direction. So we could have a leaky gut and low diamine oxidase, and therefore we trigger more histamine. And we don't degrade histamine, but we also could have an upregulation of mast cells. And so like I said, they'll increase activity secondary to chemical mediators. Toxicity in the environment is a big deal here. But infections do this too. You'll see this with Lyme disease, or you'll see this with mold biotoxin syndrome, or you'll see it status post-COVID is another time we're seeing more mast cells upregulated. So if you're going to test for mast cells, looking at tryptase, and because that's an enzyme on the mast cell that tells you when that's increased, that it's upregulated. Looking at levels of plasma, or of histamine, either plasma or whole blood. Whole blood probably gives you a better long-term picture. There's some other markers on here. They're a little harder to do, so they're not routinely done. But tryptase is probably what we look at the most alongside histamine. So it turns out if you really want to activate a mast cell, lipopolysaccharides are a great way of doing that, and they are shed from bacteria in the gut. And so this is that metabolic endotoxemia that's responsible for oxidation of LDL and for damage of our vessels and for damage of the heart, that really perpetuates cardiovascular disease that we often think is associated with aging. But in addition to that, when those mast cells are activated by lipopolysaccharides, this is a key way that the blood-brain barrier becomes more leaky. Mast cells congregate around your blood-brain barrier. They do that as protection, but LPS is particularly good at causing them to degrade. And so when we have a dysbiotic gut, more lipopolysaccharides are being created from that bacteria. They really trigger mast cells. And so it's another reason that our gut-based strategies are so helpful for overproduction of histamine. So like I was saying, we can measure diamine oxidase, and when we see it low, we can use things like HisDAO or diamine oxidase to replace the level. When we see something like zonulin high, telling tight junctions to open, creating a leaky gut, this is a time where I really love immunoglobulins. And so Ig26 immunoglobulins that are egg-based are one of the ones I reach for most frequently. They're very cost-effective. They're similar to those in colostrum and even in serum, but they're more cost effective and they don't trigger complement. So in the more sensitive patient, they can be a nice, gentle starting place. Also, their structure looks a lot like the structure of zonulin. So when zonulin tries to bind to tell tight junctions to open, immunoglobulins block that. Immunoglobulins also increase secretory IgA. They wall off lipopolysaccharides. And so these are some of my favorite strategies in terms of treating a leaky gut. And so, looking at some direct markers of leaky gut like zonulin and diamine oxidase and even lipopolysaccharides can be really helpful in terms of tracking how degraded is the lining and then building it up from there. So if we want to lower the histaminergic load, of course, we're treating the gut and often using functional foods. So one that I often reach for, OptiCleanse GHI, has a gram of anti-inflammatories, curcuminoids that reduce histamine in the gut, rutin that gets degraded in the small intestine to produce quercetin in the large intestine and also has quercetin in it. Again, quercetin stabilizes mast cells. A couple studies that compared quercetin to cromolyn showed it to be more effective, and quercetin, when compared to 20 other compounds, was the most effective at decreasing adherence of bacteria to the lining. So another way it builds up the lining. So using a functional food that combines ingredients like that, using probiotics and immunoglobulins, and of course using things like diamine oxidase can be really helpful. Okay, so we want to stabilize the mast cell. What are we reaching for to do that? Spoiler alert, probably our two biggest go-tos are omega-3 fatty acids as well as quercetin. But I did want to point out again, probiotic strains like Lactobacillus rhamnosus will downregulate expression of mast cells. So when we talk about the microbiome creating tolerance, reprogram the immune system, those are absolute realities. So Lactobacillus giving it changed genes that were involved in immune response and mast cell activation. Also downregulated expression of IgE receptors and even histamine receptors as well. So probiotics are so important. Even when people struggle with tolerating them, we've got to work them up because they're literally reprogramming the immune system. One study that I always love to think about is a study where they did desensitization injections for peanut. One group of kids got peanut, one group got peanut plus lactobacillus. They looked at their tolerance to peanut 4 years later. If you got desensitization, 4% could tolerate peanuts 4 years later. If you got desensitization plus lactobacillus, not huge gut work, just lactobacillus, 84% could tolerate the peanut 4 years later. So even if we're not doing desensitization, as we work on the gut, it's almost imperative that probiotics and things that shift the microbiome are part of that because they will change immune expression. So when we bring foods back in, we're less reactive. So we have less immune reactivity that can cause permeability. So here, omega-3s suppress that Th2 response. That is that autoimmune atopic branch of the immune system, and also talked about how it decreases mast cells as well. Omega-3s decrease IgE-mediated activation of mast cells, and they also decrease the outcomes from mast cells like allergies or atopic dermatitis. Here are some studies in terms of quercetin and talking about how it's a potent anti-inflammatory. It reduces, for example, inflammation from streptococcus, and it decreases inflammation like TNF-alpha, IL-6, various inflammasomes, and even decreasing NF-kappa B, decreasing reactive oxygen species. And there's a reference in there that talks about when compared to cromolyn, it was more effective. A couple studies looking at that, and they go on to talk about how you can't use cromolyn preventatively, but quercetin you can. Like I mentioned, look for functional foods that have bioflavonoids, citrus bioflavonoids, things like rutin, because it gets converted in the gut to quercetin, so you can deliver quercetin both to the small intestine and to the large intestine. And here are those studies talking about quercetin being more effective than cromolyn in terms of blocking human mast cells. It says, unfortunately, cromolyn is a stabilizer, but it's not particularly effective for blocking human mast cells. Instead, quercetin does block human mast cells, and so they cite a couple studies where quercetin significantly reduced contact dermatitis and photosensitivity because of that mechanism of action. Okay, rutin decreases inflammatory pain by decreasing receptors for mast cells throughout the human body. So not only does it get degraded into quercetin, but in and of itself, decreasing places for a mast cell to bind in the first place. And so when you're looking for functional foods, look for ones that have things like rutin and hesperotin and lemon bioflavonoids, because you see, for example, they show up in the research over and over. Hesperotin decreasing ischemic events from mast cells, hesperotin anti-allergic, flavonoids, again, stabilizing mast cells, and even playing a role in things like COVID in terms of being protective. Okay, so another bioflavonoid that I mentioned, another bitter flavonoid from citrus, again, that diosmin. If you'll recall, I mentioned that it decreases atopic dermatitis, and the reason that it does that is it decreases skin inflammation by decreasing mobility of inflammatory cells into the skin, decreasing IgE, and decreasing inflammatory mediators. Okay, so when we look for things like combinations with quercetin, you'll often see nettles, and nettles decreases activity of that enzyme tryptase, the one that we measure to see if mast cells are upregulated. Also, we can consider supplements like N-acetylcysteine, because they cause increased apoptosis of an eosinophil. So reaching for those as well. And don't forget curcuminoids, because they show up in studies with IBS. They show up in terms of decreasing gut-based inflammation, not just systemic inflammation. So looking for those things, of course, looking for various food sensitivities. And so this is part of how we manage histamine. So that concludes our scientific portion, and I'd now like to share with you some strategies. And so really loving working with this quercetin 20 times plus. So the big deal with quercetin is really the bioavailability of it. It's hard to get enough into the body. So often historically with working with it, I'm using 2 caps twice a day, 2 caps 3 times a day as a loading dose for our first couple weeks to really get those mast cells under control. Well, this phospholipid form of quercetin has great bioavailability, increasing it about 4-fold over standard quercetin, so that 250 milligrams counts as about a gram of quercetin, and so really seeing great stuff with this. So, for example, people that are highly allergic to cats sending me pictures holding 2 cats in their lap, something they never would have done. People that just immediately are blown up if they go out to mow the grass, taking this, noticing improvement, not having to using lots of capsules in terms of a loading dose. That one 2 times a day is quite effective. And because we're using smaller mass, they're nice small capsules as well. Here's that nettles. Remember that inhibits tryptase, the enzyme on the mast cell that causes more activation. And here's N-acetylcysteine that will also increase apoptosis of eosinophils at the same time decreasing the thickness of mucus. So, you know, we've worked with other quercetins, dihydroquercetin, but really finding the data that shows improved bioavailability in a human being is difficult to come by. So when you're evaluating different sources out there, really ask, let me see some clinical data that shows increased bioavailability. So here's a published study that's looking at improvement of absorption of quercetin. So what you see is a standard quercetin, that's group A. And so here's how much this bottom line, it increased in the plasma. Then they gave half the amount. So A was 500 milligrams. Now they gave 250 milligrams, but in this phytosome base for absorption. So at half the amount, you have a dramatic increase in bioavailability. And then when they went to the same 500 milligrams, now your area under the curve is huge, which all that area under the curve is extra time it's in the body. And so 20-fold higher for this quercetin, and you see it in terms of dosing, using 250 milligrams, but seeing much better outcomes than I was with grams and grams in the past. So here, okay, that's great. It gets in the body, but does it also improve symptoms? So here we're looking at allergic symptoms, again, using a low dose, that 200 milligrams. So in 2 capsules, there were 250 milligrams of quercetin phytosome. And looking at symptoms like sneezing, runny nose, itching, and what you see. So you do want to give it 4 weeks as you see a reduction of the symptoms compared to placebo. So this is a little counterintuitive, a lower score. So improved quality of life. Did your symptoms go down is how they were looking at this. And so you see a much better improvement in quality of life than versus placebo as well. So it's always been a great phytonutrient. The question has just been, can we get in amounts that will change symptoms? And so compared to even higher amounts, 500 and 1500 milligrams, the phytosome at 200 milligrams was shown to improve acute symptoms and reduce cytokines. Okay, the N-acetylcysteine you're familiar with, and it's our rate limiting factor in terms of increasing glutathione. More glutathione decreases inflammation like NF-kappa B, but it also reduces disulfide bonds. And when you do that, you break apart mucus. It also scavenges reactive oxygen species, so a lot that NAC does for us. Here's our nettles. It's been used eclectically for thousands of years. It will inhibit histamine receptors. It decreases tryptase. It improves anti-inflammatory prostaglandins and inhibits inflammatory mediators such as COX-1 and COX-2. A little vitamin C in there as well. We know it scavenges free radicals, but it also helps in terms of absorption and decreases mast cell degranulation. So that is the HisDAO that I've been speaking of. Another nice thing about HisDAO is they're little tiny tablets, so even young people won't struggle swallowing them. And the way you want to dose this, one with larger meals, for example, or you could take 4 acutely for at the onset of a headache. So 1 twice a day like that. You could take, a couple before a meal that you know is going to be more bothersome to you, or acutely after a histamine exposure. So a really nice tool. And when this is the thing that's off, it's a game changer for people. Definitely file it away for migraines and eczema. probiotics. And so we all know the benefit of those, but really training the immune system for tolerance. And so what you want to see is something that gives you this numeric value, because that's going to give you genus, species, and subspecies. And there's a lot of subspecies within a category. So if we want to know that the one we're working with is the one that was presented in the research, you've got to identify it all the way down to the subspecies. And so this is 30 billion CFUs. And so this one, I'm sorry, ProbioMax, 100 billion CFUs. And this is a good starting place when people are more chronically ill, more gut issues. But there's also a 30 billion CFU that you can titrate people down to, or maybe when they're doing more polytherapy, being able to start here. But when we really go look at the published research, you see a lot of good data with even down to 30 billion CFUs. So don't feel like you're cheating somebody with this. It's still well represented in the research. Okay, so I mentioned functional foods, and these can be so nice as we're getting people off high histamine foods and off junkier diets and really trying to do something to aggressively build up the gut lining. And so one of the reasons I love this is, first of all, 4 grams of glutamine. Second of all, it contains aminogen, which is a digestive enzyme. Third of all, you're going to see a lot of those constituents that I mentioned: lemon bioflavonoids, quercetin, rutin, curcuminoids, N-acetylcysteine. So a high anti-inflammatory tool, but also things to to increase phase 2 detoxification. So working on those detox planes as well, a multivitamin, minerals in there. And so when I first was explaining this to patients, I would say, it's like 5 supplements in one. But then I realized, well, people don't really take supplements. That didn't have much meaning. So I kind of went through and I was like, okay, if you were trying to provide this much ellagic acid, it would be this much raspberries. For this much curcuminoids, it's this much turmeric. And so I went through and played that game. And what I found is that this is the equivalent of 40 pounds of food in terms of nutrition and power dense foods. But for the caloric intake of 210 calories, you're also getting 6 grams of fiber. And in terms of carbohydrates, so if we are just looking at net carbs, so you're down to 6 or 7 net carbs there, so really low carbohydrate. Preventium is a lignin from flaxseed that helps with estrogen metabolism. So a really strong, powerful anti-inflammatory tool as we're getting people started on their gut healing journey. People that are very, very inflamed, like, 20 bowel movements a day, only controlled on biologics or things like prednisone, I'll use this, and I'll use it 3 times a day for 3 days in a row. And you can see remarkable changes in the gut. But for most patients, you're just using it once a day as a meal replacement, and it's really setting the foundation for that gut lining to heal quickly. I mentioned that we want to boost adrenal function to produce more cortisol. So I love this one, and maybe because I was intimately involved with formulating it, but a nice look at this is 1 capsule, 125 milligrams of glandular, 75 milligrams of Panax ginseng, or another way of saying this is, 275 milligrams of botanical for 1 capsule. That's a pretty strong amount with your ginsengs and your eleutherococcus, your licorice, Cassandra, rhodiola. Zymozyme, if we're trying to get people less reactive, using good digestive enzymes to break the foods down more. And then building up that gut lining, GI Balance is a really nice formula for this, especially if there's gut pain. And so there is quercetin in here. There is kiwi in here, but one called actinidin. It's a patented form that also has quercetin in it, but digestive enzymes that decreased reactivity to gluten. And it also builds up that mucus lining so people are less irritated. But a lot of, think of your favorite gut healing botanical or demulcent, and it's in here, and it's in here in really strong therapeutic amounts. It also exists as a powder. The only difference is that the powder has 4 grams of glutamine as well. And then I mentioned Diavast, that diosmin, that orange flavonoid, and notice that it's micronized. So this is this is used as a drug in Germany for varicose veins, but you have to use the micronized form. Why? Because the micronized form gets into the endothelium. So it's a great strategy for the glycocalyx for building vascular function. But like I mentioned, that micronized part allows it into the tissue space, keeping white blood cells from migrating there, which is why we can use it for eczema as well. So these are just some of the strategies that can be really beneficial, but hopefully this just reinforces the idea that if we work with our gut-based strategies, it is one of the go-to ways to minimize histamine, and that as we work with root cause medicine, we're going to find a way to retrain that immune system and get that person back in balance.
Wow, that was absolutely amazing. Thank you so much.
My
Been
pleasure.
waiting for this webinar, and I love the formulations that Zymogen offers. I mean, I really think they're well formulated, well thought through, for the whole person, whole body, whole approach. There are just a few questions. I think primarily you probably addressed this first question, but Meredith is asking, would love to hear any pearls about dosing the HIS-DAO. For instance, I dose up to 2 tabs with post-alcohol consumption personally and with some patients versus the typical 1 tab in the evening. Do you recommend dosing even higher than 2 tabs other than onset of headache? Do you ever recommend more scheduled dosing of more than 1 tab, or do you feel that 1 tab once a day is sufficient for most patients?
So if I'm using it as part of a leaky gut strategy, so histamine, they have a lot of food sensitivities. How about that person who they've got a bunch of food sensitivities and you just can't take them off more things? They're already off too many things. And so you're going to do the best you can. You're going to get rid of the most inflammatory foods. But in a person, and they also are more reactive to high histamine foods, that person, this is a great part of their leaky gut strategy. You were going to think of glutamine and probiotics, and those all make sense. But for this person, one with their larger meal. You could do one with each meal, but let's hope that breakfast is a little more clean. So usually just like lunch and dinner to degrade the histamine that's being produced from foods or that's in the gut, because as we do that, the microvilli plump back up and they make more of their own. Then from there, if it's not really like as much of, if it's more systemic histamine, you could just dose it 1 twice a day, and it doesn't have to be with meals, but that's your standard dose, 1 twice a day. Acutely, for a headache or some type of swelling, do 4 at once. It will work like a Benadryl without making you sleepy. And something like an onset of a migraine, do 4, wait a couple hours. You could take 1 or 2 more if there's any still residual pain, because you're not going to overdo it. It's not dangerous. We make huge amounts in our placenta when we're pregnant, but in general, 1 twice a day is probably all you need most of the time.
Do you ever keep people on a maintenance dose of that throughout or even after?
Rarely, like maybe some of the people with SNPs that you're doing genetic testing on, or the autistic kiddo. But generally what happens is the gut lining improves, migraines, really improve. And then just the first onset of that, or if they went out and were like, oh, I ate something I know that bothers me, or you can do it after the wine, and you can even do it before the wine to keep from having a headache from that as well.
Yeah, everyone's probably so happy right now. Um, Other question, love the rutin. It was in the Aller DHQ. Do you know why they removed it in the reformulation with the quercetin 20X?
Yes, because there's just such good absorption of that quercetin there, really felt like that it wasn't needed, and we wanted that space for a little more nettles because we wanted to get the increased activity in terms of turning off tryptase, so we could use it for more mast cell activation as well. But there's still rutin in the OptiCleanse GHI, so you could use that as your functional food to deliver some of it.
Okay. Elderly person in their 90s with leaky gut symptoms. Would you adjust the dosages of any of the recommended products?
Only necessarily if they're just tiny, so by weight. So you can think about the dose on the side of a Zymogen bottle is designed to be the dose that you would consume in a month if you're 150 pounds. So if they happen to be just, because of little sarcopenia and osteoporosis, shrinking down to a 98-pound, I'm maybe short like myself, you can't tell on Zoom, but I am. So shrinking down even more, then you might adjust based on dose, but the things that we use are generally so non-invasive that they're quite appropriate for kiddos and geriatric patients often because of their safety. So I would feel comfortable using 1 twice a day of His-DAO, for example, and 1 twice a day of quercetin 20X in somebody who needed it.
Awesome. Well, fantastic. I know that your time is valuable, and I thank everybody for being here. We certainly appreciate you spending your evening with us. Don't forget to add these incredible products. Create bundles on your store. Go out and help the masses with Mast Cell. Don't forget, we also have available the Whole Scripts MedPack technology through the back of the Get Healthy store, where you can absolutely create med packs with all the great protocols you heard tonight for your patients and clients. So Dr. Burdette, thank you so much. Amazing.
Sure.
And I hope you come back and do more for us. We would love to have you again.
Would love to be here. Take care.
All right. Thank you, everyone. Good night.